सर, आप अपना परिचय देते हुए आपका क्या प्रोग्राम है? What is your program?
My name is Naim. I'm professor of physiology in France since last 35 years, and we have been working on a new taste, that is the taste for fat. Why obese people love fat, and they eat more and more fat, and they become more and more obese. We have identified a receptor in the taste buds of obese subjects, and we have shown that this receptor is less expressed, is less active, means it is down-regulated in taste buds. That's responsible for less food pleasure. That is the reason that obese people eat more fat and mouthful, because less receptor means less pleasure, so they eat a lot. So we have discovered this receptor through the research of last 14 years or 15 years, and now we are targeting this receptor as a therapeutic weapon. So we have synthesized some molecules that can upregulate this receptor in the obese and then trigger a fat-like sensation. Our molecules are 80 times more tastier than natural fat.
Sir, according to your program, what is the solution about the overweight and obesity?
Overweight, that's not really so bad. But when overweight leads to obesity, that is bad. Or overweight, long-term overweight, and mild obesity. And we want to decrease it. And how? We want to decrease fatty food intake. That means less food intake, but with the same pleasure, rather more pleasure, and less obesity. Because obesity gives rise to a number of complications: arthrosis, cardiovascular pathologies, atherosclerosis, and other morbidities.
How to get benefit of society of your program?
Our program is for all the obese, rich or poor, in every corner of the world. But we want to start in India because I'm from India. So I think this is my basic thinking, that I must do something for my country. So our program is to decrease the incidence of obesity in Indian society. And we have to use our molecules as a spray. This is a new concept, new innovation.
How much expensive of this treatment?
This solution will be not more than 30 and 40 rupees per week. So it's not really expensive as we see in the market.
Indian rupees.
Indian rupees. And it's not really expensive. And the main thing is, as I said many times, that of course it's low cost but high efficient molecule, and there's no side effect, no effect on liver, no effect in the brain, no effect on the reproductive system. Molecule is safe.
Where is people get this treatment?
Now, for the moment, it's not commercialized. It will take a few years. From 2025, we will try to commercialize in India. And now
What is plan?
Yeah.
What is plan?
The plan is now, the business model says that we are starting first clinical trial, then phase 2 clinical trial, and then we will ask to the government authorities for the green light to we'll ask in the Europe.
Only government sector?
No, government will give the permission to commercialize.
Then commercialize the private and government and private sector?
Yes, everywhere. But we need the government permission.
Thank you, sir.